Good evening and welcome to the first theoretical course on the introduction to health informatics in the United States. And today we'll collectively be going through the totality of how health information systems and health informatics and the health information infrastructure in the United States is constructed. Okay? Now, the first question I'm going to ask you is, what is health informatics? And obviously by now, if you're in this class, you already kind of know what health informatics is. And the Certified Electronic Health Specialist, that certification is a subset of health informatics and its utilization in the United States. So, according to Wikipedia, health informatics can be divided into several categories. It can be divided into medical informatics, nursing informatics, clinical informatics, bioinformatics, public health informatics, healthcare analytics, and so on and so forth. And in a nutshell, it's basically an intersection between healthcare, computer systems, data, and the ability to manipulate data, the ability to store data, and the ability to analyze data. All right? So that in a nutshell is what informatics is. So we're basically talking about data, its interaction with computer systems, and also the healthcare sector. If you have a question at any time, all you need to do is to click in the box, or put your questions in the box, and I'll be glad to answer them. So, what makes up the health information infrastructure in the United States? And in this particular course, this introductory course to health informatics, we're going to discuss the health information infrastructure that has been constructed in the United States over the last 15 to 20 years. Okay? So initially, the health information infrastructure, or health informatics, the infrastructure was actually begun under the Bush administration. And then the Obama administration came in and they ran with it. So, the big thing that the Bush administration did was to globalize or nationalize the concept of health information technology and its applications in healthcare. More specifically, its applications in archiving medical records within a healthcare facility or within a healthcare setting. Okay? And the second thing that they did was lay out a framework under which the whole country can be networked. So, to produce a seamless flow of health information from one part of the country to another, or from one facility to another. So when I look at the health information infrastructure in the United States, a couple of names come out or strike me as part of the component of the health information infrastructure in the United States. And the first thing that strikes me, or the first thing that comes to my mind, is the National Health Information Network. The National Health Information Network is basically an interoperability network. And don't really bother if you don't understand all the terms I'm using. This is actually your first class, and by the middle of the class, by the middle of the course, you will understand exactly what these terms do. But for your knowledge, basically the national or the nationwide health information network is a network that allows connectivity between one area of healthcare and another in one region of the country to another. So basically, it's more or less a situation whereby healthcare data or clinical data can be transported database to database across distances. And of course, for that to happen, it means that they have to have the same standard, right? How many of you know the importance of maintaining a standard for the transport of information? Who can tell me the significance of why you would need a standard? So Abimbola says the correct information passed between facilities. That is correct. But how do you ensure that the correct information is passed from one facility to another? Well, let me ask this question this way. How many of you are familiar with any medical standard at all? Just list the standard in the box. Okay, that's a very good try, Jennifer. HIPAA is definitely a standard, but it's not a data standard. So how many of you have heard of ICD-9 or ICD-10? How many of you have heard of the CPT codes? How many of you have heard of SNOMED CT? How many of you have heard of HL7? Okay, so these are all standards that will enable the transfer of information. So let's say, for instance, there's a specific code. Let's say an ICD-9 code, a disease code. You plug the disease code because the disease code references a specific disease. You know, it references specifically what the disease is. So if you want to transfer that information from one area to another, instead of going in and writing acute lymphoblastic anemia, you might put in the ICD-9 or ICD-10 code for that. And that enables you to transfer information from one database to another. Okay? So that's exactly what, and by the time we get to the middle of this course, you'll understand exactly what we're getting at. All right? So, the National Health Information Network is almost like a banking network. And let's say, for instance, you are in Atlanta, Georgia, and you bank with Wachovia, but you travel to Los Angeles in California, and they don't have a Wachovia bank in California. Can you withdraw your money from the bank? Yes or no? Yes, you can. If you have an ATM card, you can walk to an ATM machine anywhere in the world and withdraw your money. And the only reason why you can withdraw your money from any ATM machine in the country is because all the banks operate on the same standard. So which means that when you put your ATM card into a Bank of America ATM machine in California and you say you want to withdraw money, the Bank of America understands precisely because of the codes on the card that this card, number one, belongs to you. Number two is associated with the PIN that you put in. Number three is a Wachovia bank that is based in a specific place. And number four can verify that you have money in the bank. So if Bank of America and Wachovia decided to build their networks on different standards, that would not be possible. But because their networks have the same standard, you can go to any country in the world that uses the regular ATM machine, put your card in the ATM machine, and you'll be able to withdraw some money. And so is the healthcare network. And that's the whole idea behind the healthcare network. The idea basically is you go to any part of the country and any doctor or any facility or any provider should be able to go into their system and pull up your information. Not because they have direct access to your doctor's records, but because being on the same system, putting in the right authentication, And when I say authentication, I'm pretty much talking about the security access codes that facility would need. And based on that, they should be able to access your medical records. So that's basically what you call interoperability. And sometimes it's a difficult concept to understand, but by the time we get to the middle of the course, you will totally understand exactly what it is. Okay? So the national or the nationwide health information network is a national concept. So regardless of the state you are in the United States, you are part of the National Health Information Network. Now the next stage is the Regional Health Information Network. And let me just tell you one thing about health informatics or health information technology. These things change on the dime. So what I'm telling you now is probably going to be old news by the end of the year. And with the end of the year being December, which is about 3 or 4 months away, you understand how fast things change. Okay, can you guys hear me now? Okay, great. So basically, the state of New York has a regional health information network. The state of Connecticut has one. I believe Colorado has one. California has one, and so on and so forth. Okay? Now, the entity, which means the various stakeholders or the individual organizations that come together to form a regional health information organization, are what you call stakeholders in a regional health information organization. Any suggestions, guys? If you don't have any, just say no. Okay, I see somebody's typing. I'd like to welcome Kimberly. And just for your information, this lecture is being recorded, so you can go back and listen to it a little later. Okay, so I'm asking again, should I give you guys some clues? Who can name for me some healthcare establishments within your area? Excuse me. Okay, sorry about that. I was knocked off the internet for a quick minute. Okay, so where were we? Okay, we were talking about medical errors, then avoiding the repeating medical tests, and so on and so forth. Okay, so the next thing all the electronic health, all the health information that was basically written up about you before the advent of electronic health records are basically what you would call paper records. So they would take these paper charts and they would scan them as files into the electronic medical record. Okay? So that's basically what they would do with your previous history. And some facilities go back as far as 5 years. Some facilities go back as far as 10 years. We were talking about electronic health records as a longitudinal record of health. So basically, anytime you record patient demographics in any way, shape, or form in relation to their health care, it forms an electronic health record. So, I know probably a little past time, but we'll try and rush the rest of it, okay? Now, the electronic medical record is a little different from an electronic health record. So basically, an electronic medical record is an electronic health record because it constitutes one of those applications where you record patient information. However, the electronic medical records more specifically is a provider application. So it's an application that you get in a hospital or an ambulatory clinic. So whenever you have a physician or a healthcare worker entering information about a patient into some sort of a database, you will call that an electronic medical record. But anytime any information, health-related information is recorded in an electronic health record. So an electronic medical record is an electronic health record. But an electronic health record is not necessarily an electronic medical record, if you understand what I'm trying to say. So, the clue basically is the electronic medical record, or EMR, belongs to a specific organization, whereas an electronic health record might not necessarily belong to one organization. For example, the Nationwide Health Information Network is an electronic health record. But when you go to your doctor's office, he records your information in an electronic medical record. Okay, so that's all I'll pretty much say in regards to the electronic health record and electronic medical record. That this slide just basically clarifies for you, what the differences are between the electronic health record and electronic medical record. Now, another thing that you have to take cognizance of is that when you're talking about databases that follow you, your EHR follows you, but it contains a bunch of information that might not necessarily directly relate with you. Your electronic medical record is owned by your provider, but it archives or stores your information when you see him. Your personal health record, also called the PHR, is a tool that you would use. So the PHR belongs to you. And it should basically track your healthcare records as well. So theoretically, your personal health record should be able to download all the information from every single encounter you have with the healthcare system and store a copy for you. All right? So the PHR can pretty much save money, avoid inconvenience, and hold information that could be key towards you getting proper, accurate, and cost-effective care whenever you visit a healthcare provider. Because there are a lot of medical terms or medical situations where you as a layperson, and that's with the presumption that you're a layperson, might not necessarily remember about your health. For example, what were your blood levels of certain types of hormones or ions or different things like that. And even if you're a healthcare worker, there are many details of your health that you might not necessarily remember in detail. So that pretty much is the function of what a personal health record would do. All right? So next, and I think we're about getting to the end of the course, and I think we're actually there. These are your references. All right? So I'll go ahead and place both the slides and the video recording on inside the online classroom for you to access latest tomorrow. Are there any questions before we end the lecture for today? So, thank you very much for attending today's lecture, and I wish you best of luck with your assignments this week. Okay? Now, I want to take a quick consensus before we go for today.